or anything interesting about your location? Get this chat. I see. My eyes spy Felicia. Hello, Felicia. It's good to see you.
Hi, everybody. It's really great to see you on this Thursday. Thank you for being here. We'll give everybody time to get in and we'll start promptly at the next 1 to 2 minutes or so we don't waste your time. Hi, Kristen from Louisiana. Thank you for being on. Great to see you.
She meant Louisiana, Kristen. She meant Louisiana. Oh, good. Okay. And just so everybody knows, you are muted and the cameras are turned off for the recording today. So that we're just protecting your privacy because we'd like to share this. So just so everybody knows, we will interact with you in the chat for sure today.
We started it a little early, so we'll give everybody about another 30, 60 seconds to join us and then we'll get started.
Love those cute baby faces. Bridget from Delaware, thanks for being here.
All right, I think we can go ahead and get started. And if others join, that's great too. We are so thrilled that you're here. We really appreciate the fact that you're spending time with us today. And we hope you'll find a lot of value in the next 60 minutes. The babies on the screen are living proof of the impact of Count the Kicks. These are just some of the lives saved through our program. And we know we can save lives in your community, in your system, in your state when we partner together. This is why we're here, and it's an example of what we can do together. As you already know, Count the Kicks is a highly effective evidence-based stillbirth prevention program. We developed a proven early warning system for moms. We have saved lives in 36 states and in 6 countries, and we want to save more lives in your community. I'm Emily Price. I'm the CEO of a nonprofit organization called Healthy Birthday Inc. It is the nonprofit focused on stillbirth prevention that created the Count the Kicks public health program about 15 years ago. And I'm joined today by my awesome colleague, Sarah, who I will let her introduce herself.
Hi, everyone. I'm Sarah Coleman, and I am the State Expansion Director here at Healthy Birthday Inc. And in my role, I support states when they enter into partnerships with us, organizations in those states enter into partnerships. I support that launch and make sure that we are being responsive to the needs of the community. And we'll kind of get into a little bit more about those contracts here in just a little bit. But thank you for being here with us today.
Thank you, Sarah. One of the things that we wanted to share with you is a really new development that's happened in stillbirth prevention in this country just this week. There is a huge call to action from Congress just this week on Tuesday for state health departments to use their Title V dollars on stillbirth prevention. So on Tuesday, late in the afternoon, the United States Senate unanimously passed the Maternal and Child Health Stillbirth Prevention Act. This adds stillbirth and stillbirth prevention to Title V. The president has until next Friday to sign the bill. You can currently use your Title V funds if you receive them on stillbirth prevention, and 20 states are doing so right now. By using Title V dollars on implementing Count the Kicks, in your state. So this bill is a technical fix to ensure that stillbirth prevention is noted and included, as well as a call to action to use Title V dollars on stillbirth prevention. When Title V was written back in 1935, stillbirth and stillbirth prevention was left off. We think probably because way back then, 90 years ago, everybody thought, well, stillbirths just happen. They just happen. They can't be prevented. But we know that that's not true. We can help prevent preventable stillbirths. At least 25%, in fact, research shows at least 25% of all stillbirths can be prevented. And that's exactly why we're here today. That's what today is about. We are thrilled you're here. You are part of a sea change in this country to focus on stillbirth prevention. During our time today, we're going to answer all of the questions you may have about launching Count the Kicks with us. Things like, what funding mechanisms do partners use? Are you a sole source, Count the Kicks? How much time is this going to take out of my day, from my team's day? What should I do first, and how much does it cost? We have some slides we want to share with you about what goes into the implementation of Count the Kicks if we were to work together, what it might cost, how we reach providers and parents, and more. We're also going to have time at the end for more conversation, for live questions from you, so that Sarah and I can both answer any questions you may have. And then we also welcome a private meeting with you or members of your team in the coming weeks, so that we can answer any additional questions that are unique to your role and to what you want to accomplish.
So just a little bit of background about the HRSA outcome measure on stillbirth. Many states and counties have an increased focus on stillbirth prevention in the past months and even in the past years. So HRSA announced recently the addition of a new national outcome measure focusing on stillbirth for the very first time. So this happened last September. We know that stillbirth prevention has a tremendous return on investment. The tragedy of stillbirth can be avoided in so many cases. When we prevent 25% of all preventable stillbirths, that's approximately 6,000 lives saved per year. We also know that stillbirth prevention can help save the lives of expectant parents. And you can read more about the HRSA focus on stillbirth prevention if you scan the QR code right there in front of you. Additionally, AMCHIP, who some of you are probably very familiar with AMCHIP, our program was named a best practice by AMCHIP in 2021. After a thorough scientific review, the leading maternal health association in the United States determined that our program meaningfully engages stakeholders at all levels of practice, ensures improving health equity is an integral component of overall program sustainability, has been externally validated by another entity, and replicated with similar positive results in another context.
And so this is why we are all here, the public health crisis of stillbirth. We want to abate the stillbirth crisis in the US. More than 21,000 babies are stillborn every year, according to CDC Wonder and National Vital Statistics. This is approximately 7 times the number of those lost to sudden unexpected infant death. And so in viewing this slide, you're going to see that it's clear there are vast differences in the stillbirth rate affecting Black, Indigenous, Native Hawaiian, and Pacific Islander families. These exist and persist and need to be addressed through systems change. And that's what Count the Kicks helps bring to the table and what we've done in Iowa. It is outrageous that every 1 in 100 Native Hawaiian or other Pacific Islander and Black pregnancies end in stillbirth. This is far too high. These are terrible odds. When Count the Kicks is introduced into pregnancy, we improve these odds. So I'm actually going to stop sharing, and I want to show you one tool that's going to be helpful in your conversations with your team, potentially if there are others on your team in this decision-making process. So I want to share one unique tool that could be helpful in the conversations that you're going to have. So I'm going to share with you a live look at our website. So this is countthekicks.org. You can come to this anytime, countthekicks.org. And one interesting thing that might help you in your decision-making process, if you go to the tab called Why We Count, and then you go to Stillbirth in the US, you can see here, this is a map about the prevalence of stillbirth in your state. So you can go and click on your state. Let's go ahead and we'll click on Alabama, for example. So what you're going to find here is data. This is from, again, National Vital Statistics that shares with you that Count the Kicks has, found this data that in Alabama, we lose 513 babies on average every year in Alabama to stillbirth. And then when you click on Learn More, you're going to find even more data that might be helpful to your conversations. Again, this is all from National Vital Statistics. It's going to give you your state's stillbirth rate. And then over here on the far right, it's going to share with you the number of babies we think we can save in your state. And I realize many of you are from counties and not necessarily the state health department. Some of you may be from an independent organization. And so this conversation today is really crafted for all of you, for state health departments, county health departments, community-based organizations, anybody that wants to work with us, we welcome you. We want to work with you really badly. But I just wanted to share that so you could see kind of a view of that. But I'm going to go back to our regularly scheduled program. And I'm going to turn it over to Sarah to talk a little bit more now about sort of the other proven methods, proven ways that we help improve outcomes, not just stillbirth prevention.
Yeah, so while we started as a stillbirth prevention program, we know that benefits go far beyond just stillbirth prevention. So our program is proven to identify pregnancy complications that threaten a mother's life. It's proven to increase gestational age and proven to reduce the NICU stays. So you may be wondering, how do we launch this in your state? Let's get into this. So this is the life cycle of when you partner with us at Count the Kicks. So the first stage is the planning stage. We offer an a la carte approach based on the needs of your state or county. So we have a variety of deliverables that we are going to show you in the next few slides. These are all available to a state or entity when they determine they want to partner with us. So everything from webinars and health worker trainings to kick counting wristbands and printed educational materials translated into languages that help you reach important populations. These are all components that we use. And once you learn more about these items, you can decide what fits your needs for your state and your strategy. We believe in a data-driven approach. So when we agree upon the components that you want, we'll talk about what a launch looks like in your state and the associated costs and timeline based on what you have chosen. We can absolutely make recommendations for you, as well as what we have learned on working with some of the diverse regions across the country. We've worked in urban areas, rural areas, from east to west. But we'll take what we have learned on that kind of journey, and we will talk about implementing the program inside of your state and what that looks like. We'll apply all our knowledge and expertise to your launch, as well as the strong desire to learn more from you about your area, your data, and your goals. The second phase of our program is implementation. So implementing Count the Kicks in your state, in your system or your county. We do this first by notifying the providers, the system, the community organizations who work with expectant parents about our partnership. We do this through a press release. We also do a letter, an email campaign, and a launch webinar. So kind of like this, where we introduce the word to your community. All of the materials and the deliverables will be co-branded with your logo to emphasize that Count the Kicks is being brought to you by the state or community because of your investment in improving birth outcomes in your state. And then the final phase is the kind of that data and reporting stage. So each quarter, my team will provide vital data back to you and your team so that you can see the quantity of materials that went to providers in your state. You can see the number of app users that are in your state, the number of people who are visiting our website to learn more about fetal movement monitoring from your state, the number of health workers trained, and so much more. So this data helps to get a clear picture of the spread of Count the Kicks in your state or community. And just as a reminder, our goal is to replicate the success that we have seen in Iowa inside of your state. Our ultimate goal is an overall 32% stillbirth rate reduction with a major reduction focusing on those racial disparities. We want to narrow the gap. We don't want to be a part of widening the gap. So we want to reduce racial disparities that persist in birth outcomes. The more we pour into your partnership, the better the outcomes we will achieve together.
Thank you, Sarah. Here is the core of how we do it by sharing Count the Kicks printed educational materials with every expectant parent in your state or your county, your community. We offer posters that you see on the right side of the screen, brochures that you see on the left there, and app download reminder cards. They're all already in English or Spanish. You can also choose to have these printed in additional languages to suit the populations that you serve. Once we launch in your state, providers can then order these on our website, countthekicks.org, anytime they wish. Your investment in this program makes these free and removes a significant barrier for providers in your community. And when I use the word provider, I don't mean just obstetricians, but nurses, WIC clinics, doulas, general practice doctors, federally qualified health centers. By removing cost as a barrier, you are removing a significant barrier for everyone having access to these to share with expectant parents. The ordering process is extremely easy. I liken it to going to Amazon, which I'm really good at. Office staff, doulas, nurses, and more can just fill their cart with the quantity that they need, and our fulfillment center ships directly to them within about 10 to 14 days. Your team does not have to do a thing when it comes to fulfillment. And we are, again, are going to report back to you on how many materials are being sent to providers and community organizations in your state and in your community. With health equity and health literacy at the center of our work and how important that is to this work, we offer at-a-glance materials that are heavy on pictures. They offer a visual way to understand our program and why paying attention to movement in the third trimester is so important. These are great for folks who may be new to our country, where English may not be their first language. And so this is a good time to let you know that we do have a dedicated health equity manager on staff who will first review your county level data, your race level data. So we are informed on the specific needs of your county, your state, and we're going to use that data to inform all of our decision making and our work with you, and just all of the work in general. Like if we're going to place a billboard in a certain community, what is the zip code that most needs to see that message? Those are the kind of ways that we use county level, race level data to inform the implementation of our work. So these materials that you see on the screen are part of the a la carte options you could choose if you decide to work with us. So you could choose just at a glance, you could use what we call just quote traditional or original posters, or you could do a combination of both. After your team has then approved the logos on the materials, we have received a comprehensive contact list from you of people and providers that you want us to reach, combining it with the provider list that we have purchased already as an organization. Count the Kicks we're then going to conduct a mail campaign to providers and community-based organizations announcing the launch of the program in your state. And so a sample mailing you can see in the upper right-hand part of the screen. We have a letter that goes out just like that. It's drafted by us, but can be edited and signed by someone on your team. So when we launch in states, for instance, it's typically the MCH director or the Title V director that would be the one who signs this letter and who this is from. The letter on the screen talks about, it shares the evidence behind the importance of fetal movement monitoring. It's an empowering message to implement the program within their practice or their birthing hospital. And it also shares the goal, the overall goal to prevent stillbirths in your state or community. In addition, on the back side of that letter, are very visual step-by-step of how you order the free materials. So if this is going to the office manager at a large OB clinic in Cincinnati, for example, they're going to read this letter, they're going to flip it over and see the very easy way to how to purchase, or I'm sorry, how to order materials. And then they're also going to receive sample materials, a sample poster, a sample brochure likely, that they can see exactly what they're going to get when they order. So they can see what it's going to be like. Our staff, again, this is a turnkey operation. So our staff is going to mail that announcement letter once we have your approval and signature. We're going to mail the sample Count the Kicks educational materials to providers across your state that are on that provider list that we have. The only legwork that you and your team need to do is to approve the letter and approve the placement of your logos. That's all you have to do as a part of this deliverable. Next, using that comprehensive email list of traditional and non-traditional providers in your state, Count the Kicks is going to send a co-branded email to stakeholders throughout the state to announce the partnership. So it's very similar to this handwritten letter, this typed letter, but it's going to go out through email. And it's going to highlight your investment in this work. It's going to allow recipients to click directly through free resources available to them, and it's going to show them how to order materials online. So when you can't really send links in a printed letter through the email, we're going to send some great free digital tools in the email. Things like a 55-second Count the Kicks how-to animated video that some people maybe play on a flat screen in their waiting room or maybe put on their social media channels. We're also going to have step-by-step instruction on how to count the kicks in the third trimester, so providers know how to talk about this with patients. We're going to provide step-by-step instruction on how to have that kick counting conversation. We have links to downloadable kick counting charts, easy to use lesson plans for childbirth educators, testimonials of and videos from baby safe families of how this impacted their life. You can see other deliverables on your screen there that can be a part of our launch together or our work together. Things like refrigerator magnets in different languages for expectant parents, badge reels and badge buddies on the center of your screen there for providers that providers love to wear on their lapel or their shirt during the day. We also have kick counting bracelets. You can see that in the upper left-hand side of your screen, that teal bracelet that mama is wearing there. This kick counting bracelets are great for moms without smartphones, moms that maybe don't have good broadband or strong internet. We also have co-branded, or rather branded pens that can be, on the in the waiting room or at the checkout at the OBGYN office that kind of helps spark that kick counting conversation between patient and provider. And all of those wristbands, by the way, do come with that postcard that you see on the screen. It's a very simple, easy how-to, like how do you use this? These are all examples of components of deliverables that we could have in a launch with you. Sarah?
All right. So another way, so building on what Emily was talking about, all those components are our toolkits. So these are a valued resource for state partners to distribute to providers, doulas, home visitors, community health workers, and recently WIC clinics is another big focus for us. So anyone who's working in highly impacted areas with expectant families. The toolkit can include printed materials, English and Spanish. If you have additional languages in your state, we can provide those as well. Pens, wristbands, the magnets, badge reels, badge buddies, paper movement monitoring sheet. And I think maybe Megan will throw a link to that in the chat at some point here. But a tip sheet will kind of tie all this together and educate the providers to assist them in the implementation of the evidence-based program in their work and how to provide that education to empower expectant parents to pay attention to their baby's movements in the third trimester. So in these pictures, you can see there are a couple different options. And basically, we've curated them on the audience, on the receiving audience. So the toolkit on the left, that was for rural providers, and therefore it included printed materials, paper kick counting charts, and the wristbands. That was the focus, is to think about people who might not have that access. And then the toolkit on the right was for OB providers, and you can see some co-branded collateral in there. And this also included our printed materials and badge reels. So two different ways that we can utilize toolkits. We also, you can see those smiling faces in the middle. So we engage our community volunteers to fulfill these projects, these toolkits, when we pack them in our office. Everything we do is very turnkey again. It takes limited staff time on your end to implement Count the Kicks in your state or community. So we do 95% of the work. So just like as you see these toolkits here, we will assemble them and we will mail them out. You do not have to get the components and put them into a box. We will do that for you. That's that turnkey part. So we also have a communications team that will implement communications deliverables. We call this the digital media package with approval from your team. So we focus on the digital communication efforts about Count the Kicks through Google display ads, social media, and other online platforms to reach more expectant parents with Count the Kicks education. So these efforts will encourage pregnant individuals to use our app as a free fetal movement monitoring tool with highly engaging content like save stories, data on the effectiveness of Count the Kicks, and so much more. Over the past year, we've had millions of views on videos that have gone viral. Moms talking about how the Count the Cakes help get their baby here safely. Mom to mom sharing is a great tool. It's the number one driver that we have to get more expectant parents to use the program. And so one of the biggest ways we raise awareness is through the social media platforms. And we should note we do not use public funds on TikTok, which is all my China, only Meta platforms, Google Ads, or LinkedIn.
Thank you, Sarah. So here are some additional ways that we can raise awareness that would be in that deliverable database that we're talking about in your community. We offer things like billboards that you see on the screen. We have several of these dotting the freeway in Orlando, Florida right now, and Las Vegas, Nevada, and other places around the country to help raise awareness just about that the program exists in their state and to catch the attention of an expectant parent. We have webinars, health worker webinars, trainings, online CE training for 4 CE credits. We have those toolkit mailings for providers and community-based organizations, and more. And so that's just another look at some of the things that some of the deliverables that are available. And this is another look at our free app that you probably learned about during that HRSA webinar, or maybe have heard about previously. This is already available to parents in your state in 21 languages. There is no other kit counting app that has 21 languages. With health equity at the center of our work, we're doing our best to make this available in as many languages as possible as we receive funding to do so. So what we want expectant parents in your community to do is starting in the 3rd trimester, every single day, we want parents to count their baby's movements. This is the just the crux of the program. And so what we want them to do is to choose that time of day that their baby is most active and to continue counting around the same time each day. So we encourage patients to register on the app so that they can get all of their data history, that pink and red graph that you see on the screen. So when they sit down to focus on baby during their daily kit counting session in the 3rd trimester and they feel that first movement, they're going to hit the big teal footprint that you see on the left side of the screen on the app. And once they start, a timer is going to start. They tap on the footprint every time they feel a baby move, push, kick, jab, roll. And then when they get to 10 movements, and that mama has counted 10 movements, the timer stops and the app user to rate the strength of their baby's movements. Research shows that not only should we be paying attention to how long it takes a baby to get to 10 movements in each session, but we need to rate the strength of those movements. And so the app is going to show the graph, a visual representation of how that baby has been moving, that average amount of time it takes their baby to get to 10 movements. It's also going to show them that average strength of the baby's movements. So if all of a sudden a baby has been on a scale of 1 to 5, a 5 in strength for many days, and all of a sudden that 5 baby has gone to a 2 or a 1, that is a cue that mom needs to speak up and tell her provider. So again, the goal is for expectant parents to learn their baby's normal movement pattern, how long it takes to get to 10, and understand that every baby and every pregnancy is different. So my baby on average might take 25 minutes to get to 10 movements each day during my kit counting session, but it might take Sarah's baby 4 minutes each day to get to 10 movements. But I need to know that 25 is normal for my baby, and she needs to know that 4 minutes is normal for her baby. So if they do notice a change, that graph on the screen is going to shoot way up. It's going to be a visual cue that something has changed in that pregnancy. And we have loads of information and education throughout the app that empowers them to contact their provider if they notice a change. And as you've already heard before, if you've been on webinars with us before, oftentimes, a change in a baby's movement is a precursor to stillbirth. So many women in this country report after stillbirth that they noticed a change in their baby's movements, but they were never told that it's a red flag. They were never told it's a warning sign. They were never told how to get to know what their baby's normal is. And so that's a gap in our system. It may be a gap in your community right now. We hear from moms every day who say, I wish I would have known about you. I noticed a change, but I didn't know it was important. I didn't know that I should speak up. Or in some cases, we have plenty of women who speak up and their concerns aren't taken seriously, or they're sent home, or provider doesn't really have a protocol to follow as to what to do to see if that baby, to investigate if that baby is truly in distress or if that baby is just having an off day. So that's why our organization not only works directly with expectant parents, trying to raise awareness among expectant parents, We also work heavily with A1, the large OB Nurse Association in this country, on a standard protocol of what providers should do when a mom comes in with a change in movement. And also just training providers on this because they don't always have that training and education. It's not been the center of their work. And so we also know that our app is a powerful tool to lower anxiety in pregnancy and also increase bonding with baby. One of our goals when we launch with you is to raise awareness about the free tool, the app, and using it every day in the third trimester. So whether it's through social media, billboards, baby showers, webinars, things like that. There are no ads. It's very important for you to know we are a nonprofit, so there are no ads. We don't sell user information. We don't share it. It is completely private, completely secure. 77% of app users say the app helped lower their anxiety in pregnancy, and 84% say it helps them bond with their baby during pregnancy.
And I just want to highlight, we know that we have a question, the question and answer, so we will get to that. Thank you for putting any questions that you have there or in the chat. We thank you for the opportunity to answer those questions. So let me tell you a little bit about the Social Determinants of Health survey on the Count to Kicks app. Some of you may be referring to this as social drivers of health at this time, but this is a contract option for our states and entities that we engage with. So what this means is expectant parents in your state who are using the app, they'll get a survey after the second kick counting session. It's completely voluntary and it asks them simple yes or no questions. Things like, do you need access to safe housing? Would you like to be connected to a food pantry in your community? So then when that survey is complete, when they go through all of those questions, they are taken directly to free resources within their zip code if they answered that they wanted help or a connection. So whether it's needing access to an obstetrician, childcare, safe housing, or something else, we'll work with you to draft 4 to 5 survey questions for app users on accessing services. And then we'll connect those app users with the local resources on Find Help as determined by zip code. And if you have some resources you want to make sure are there, you're welcome to send those over to us and we'll get those connected. So responses gathered from the app will be included with the quarterly reporting that my team sends out. You will learn more about the kinds of needs of expectant parents in your community or state. Additionally, something that is already on the app for all app users right now, we have added a resource to go in and directly access free or reduced cost services within that zip code. So the social determinants of health questions will drive them to specific resources, but any expectant parent in any state, any app user can go into the resources section of the app right now and search by zip code in our Find Help resource to find things like dental care, diaper banks, WIC clinics, and more. So if we can help connect people to resources like this prenatally, the chance of the baby experiencing an ACE can decrease. So this is a community, completely free resource that highlights resources in your community, and that exists right now on our app.
Thank you, Sarah. I would love to address some of the questions and things you might be thinking right now. So here's a list of some of the frequently asked questions that we get. And then immediately after this, we're going to dive into the Q&A section as well. So please go ahead and put any questions that you might have in there. And so first, one of the questions that we get quite a bit is, can our work together be a contract or a purchase order? Like how the logistics behind this, how do we do this? And the answer is yes, we can do both: a contract, a purchase order, an invoice. In some states, we have multi-year contracts, some as long as 6 years. And in some states, we simply have a purchase order. Like in South Carolina, they use a purchase order every single year. So we can work with whatever is best for you and your system. In our experience, purchase orders are less time consuming and less paperwork for everyone involved. But we also understand and can easily work through a contract process with you as well. We can use one of our standard contracts that we already have in place and have sort of standard language. Very simple. It's not jargony. It's not too lengthy. Or we can also use one of yours. We are also used to going through the sole source process if needed. We are the only organization, as I mentioned, or company in the US that created the tools and resources to educate and empower pregnant women to movements in the third trimester. And we are the only entity to provide a continuum of this kind of stillbirth prevention education to both moms and health providers. The totality of what we offer, like those educational brochures, posters, app download reminder cards, kick counting wristbands, a free 21 languages, free online digital tools, including how-to videos, childbirth ed lesson plans, training for providers, and more, is unmatched. So another question that we often get is, what kind of funding streams are people using to implement Count the Kicks or stillbirth prevention in my community and in my state? So because we have a variety of different professionals on this call today, I'm going to go ahead and share with you the broad ways people are funding and finding funding for Count the Kicks. So some of those ways, we've seen everything from Title V MCH block grant funds. We have received funding through MCFE dollars, a line item in your state's budget, perhaps grant funds that you have received to improve birth outcomes for either mom or baby. We also have received things like maternal mortality grant funds, because this also is proven to help improve outcomes for moms. We have had many moms let us know that Count the Kicks not only helped alert them to an issue in their pregnancy, but issues with their own health as well, as Sarah mentioned previously. So things like undiagnosed preeclampsia, or the start of a maternal fetal hemorrhage, the start of a placental abruption. And so that's why many organizations have been able to find maybe some of their maternal mortality funds that they have in place to be able to be used on Count the Kicks. Also, oral health departments have funded our work. Some organizations use their marketing dollars, their communication dollars, and also just any general maternal health programmatic line items. So another question that we get is like, how much is this going to cost? What's the ballpark cost to implement this in my community, in my state? And I would say a good rule of thumb is a bare minimum of $2 per expectant parent we're trying to reach. So this is not expensive, especially considering the kind of ROI and lives saved, which is huge. So let's say, for example, you have 6,000 live births in your community each year. That means the minimum amount to launch would generally be about $12,000 as a minimum to get started. With that said, we encourage you to lean into deliverables that you know will work well in your state or your community. So the more outreach we have, the more present we are with health worker trainings, billboards, social media videos, the greater impact that we are going to have in your state. We have some states spending up to about $8 per pregnant person in their state through Count the Kicks, because marketing research shows someone has to see something typically 3 to 4 times to take action. So this is why you see incessant McDonald's commercials or Coke commercials, right? It reinforces that they exist. And so our goal is that each expectant parent, when we launch somewhere, is in your state, is going to get, say, a brochure from their nurse or a doctor. They're also going to see a viral video on social media. They're going to have their nurse or doctor is going to be fully trained on Count the Kicks and is going to have a proper kick counting conversation with them. Also, maybe she's going to visit our website to see more information like Mythbusters or helpful how-to videos. The more that they see Count the Kicks, the more that they hear about it and it's reinforced, the more likely they are going to use it as a daily practice to monitor their baby's health in the third trimester. So again, we can work within your budget. The greater your budget leads to greater awareness, tends to lead to more lives saved as well. That makes sense. But we want to work within your budget, whatever is available to help with stillbirth prevention in your state. And so finally, a lot of questions, we oftentimes will say, how much is this going to take for my day, my staff's day, things like that. And so as we've already mentioned, the staff time is quite minimal. Our team does do 95% of the work, and we're going to share back to you. The great thing is we're going to share back to you all the data that's been generated from our work together. As we mentioned, material order numbers, really strong data points to show you the ROI on your investment. Coleman?
All right. So you can see, there they go. They're populated. This is our team. This is the team that will work with you on the implementation of Count the Kicks. So their years of experience and expertise all across all of these spaces. This will be applied to the work that we do with you. We are all dedicated to the success of the launch and implementation with you, and we want nothing more than to prevent stillbirths and improve outcomes for moms with you. So I will be your immediate point of contact. I'm the State Expansion Director. Sarah Heibel's in that pink, beautiful pink Blazer. She helps me execute the specific deliverables and coordinate the timing of the deliverables. Christine is our health equity manager. She will study the race level data in your community. She will learn from you about which populations have the worst outcomes and the best ways to work alongside them. Suzanne oversees invoicing and smooth financial transactions. Excuse me. I was ready to say translations, guys. I'm ready for translation. So transactions. Carol works on compliance, ensuring that we meet all the requirements in your state or community. Kimberly and Megan are our wonderful communications whiz team. Caitlin is an admin assistant who ensures all the fine details are taken care of. And Megan is our program director and who's also hiding behind the scenes today, helps to present to doctors and maternal health professionals. Jen connects high-level volunteers in your state to this work. I know we've got a community advocate on the call today, and we thank her so much. And then Brenda may have the coolest job of all. She's the first person to hear from expectant parents when their baby's life is saved due to the program, and then we immediately share that story with the state partners and eventually the media if that mom is willing to speak out publicly. And Emily again is always here for anything that you need.
We have an amazing team that's ready to help launch in your community right now. So here's the next steps. We're going to share with you our deliverables database and associated costs so you can decide what best suits your needs and your budget. And then we will create a custom scope of work for your state, your community, your system, your county, based on the deliverables you've chosen. So the costs associated with your deliverables are all going to depend on the number of expectant parents we're trying to reach in your system, your county, or your state. So the state of California, for example, is going to be more expensive to implement Count the Kicks than, say, a small county in North Carolina. An SOW that we create for you will be tailored from our deliverables bank to make sure we're reaching as many medical community-based providers in your state as well as expectant parents. So if you are now interested, you've sat through this part of the presentation, if you are now interested in seeing a deliverables database and associated costs, please email us. Our email is on the screen. Mine and Megan. Megan is also on the call today and helps get folks started. And then Coleman, Sarah, is the next part of the process in implementing the program. So if you're interested in seeing that deliverables database and associated costs, please email Megan or I on the screen there and let us know. The one thing we need to know before we can share cost would be the number of expectant parents that you want to serve and that you need to serve. So if you're a county in Tennessee and you're on here today, we just need to know how many live births that you have in your county each year. And that's going to help set us up to know what the associated costs will be. And so this is going to inform us. And now we would love to turn it over to questions. Thank you so much for getting to this point of the presentation with us. And I would love to, let's go ahead in the Q&A. I see the first question that we have is, if your website lists an existing partner in our state, how can we contact them and learn what they are already providing? This is a fabulous question. Why don't you go ahead and email either Coleman or I and let us know where you're located. And then we can likely put you in touch with that funder or that person who has launched in your state. But one thing I want to make really clear that really is sparked by your great question is one thing our organization will not do and does not do is duplicate deliverables. So if you see that we're already in your state, let's just say the state of Georgia, for example, if we already, let's say you're a county in Georgia or an organization in Georgia, we already receive funding there from the state health department. They have the co-branded printed materials and things like that. We are not going to duplicate what we've done with them, meaning we're not going to double charge or things like that. We're going to find a deliverable that is not being filled in your state or your community and let you know what that is. So for instance, there are plenty of states that don't have any billboards, by the way, like lots of states that don't have billboards. So let's say you're in a state that already has a really good funder that is doing a lot of work there, but we don't have any billboards there, or maybe we don't have any digital ads or social media ads. That is something that we could work together on because it's not a deliverable being met with another partner. That's something we could work on together without infringing on the partnership we already have with like the original funder or the current funder. So just know that, but it is a great way to be a part of this work and to further enhance the work that we're doing, because truly that research about moms having to see things 3 or 4 times before they truly take action is real. Yes, they can go have a great conversation with their provider, but then if they also see it the next day on social media or their girlfriend talking about it, or it shows up in a baby shower, that's really going to remind them or reinforce. Download that app, pay attention, do your daily kick counting session. So thank you for that question. Reach out to us and we will definitely let you know sort of who that funder is and how we can all get connected to talk. I'm just looking through the Q&A and also the chat. Oh, thank you for the information about the baby picture. Thank you. I appreciate that. We'll remove that. Thank you. All right. Are there any additional questions we can answer?
I can tell you, we want to be in your state. We want to be in your community. So please, please, please reach out to us. We definitely want to be walking hand in hand with you in this program. So if there are questions you think of after this, when you see the slides, don't hesitate to reach out to us. We really want to respond to you.
And I'll just add, this is Megan. Hi, everybody. I'm the program director here, and you can expect a recording of this being sent to you along with the slide deck, as well as next steps. So look for that in your inbox coming soon.
Since we technically have 15 minutes, I'm happy to just stay on. If you think of a question, reach out. Happy to answer it. If you want to go, that's great too. And just reach out by email. And we'll share that deliverable database with you. But I'll just be sure to stay on until everyone is gone in case you think of a question while we're here.
Have a great day, everybody, if you're leaving us.
Thank you.